Hey guys, Diane Burrows here from BirdSupplies.com, and today I want to talk with you about parrot pain prevention and management. Now, if you've been following my recent videos lately, you've realized that I've been doing a lot of research on what is parrot wellness. Research tells us that the best thing that you can do to manage challenging behaviors in your parrot is to establish a routine of important parrot wellness strategies that will support it. And so, there's not a lot of literature around out there of what is parrot wellness, but the Richard M. Schubolt School of Veterinary Medicine in UC Davis really hones in on what is parrot wellness, and they do a whole lot of research pertaining to it. So I have been using them as kind of a springboard for developing a new version of my parrot feather plucking book. And today I'm going to talk specifically about parrot pain prevention and management as it pertains to enhancing parrot wellness. So like I said, the Richard M. Schubolt School of Veterinary Medicine out in California focuses specifically on parrot wellness. They have an entire program for that, and they've had a number of veterinarians that have come out of there who've taught us that the most important things that you can do to support your pet bird is to stay on top of preventative health care for your pet. Those yearly exams, we know those are so important because parrots hide their illnesses and they hide their pain too. They also talk an awful lot about what is a species specific diet and enhancing parrot nutrition. And we know that vets see as a major part of their practice the complications of malnutrition. There's so many myths out there about what is proper parrot nutrition, and I think the Schubolt team, and then along with Jason Crean and some of those folks, have developed some clear guidelines that really make sense in terms of what is proper parrot nutrition. They also talk about parrot environmental enrichment as being huge, as well as behavior training, pain prevention and management, and then of course pediatric and geriatric care. So specifically today we're going to talk about the pain management. Now let me back up a little bit. I'm Diane Burrows. I'm the founder and CEO of BirdSupplies.com. I'm a licensed psychotherapist with over 30 years of experience. I'm an ABA therapist and a bird behaviorist. And I'm the founder of the 20-year-old company BirdSupplies.com. I originally started this company back in 1998, and I've made it my life's mission really to enhance the quality of life for our pet birds. So circling back, let's talk about what is pain. If you've ever had a surgery or something, you know the feeling, but how do you describe what it is? Well, pain is something that tells us that something is wrong. It's time to take better care of yourself. So pain serves an important function by giving us like a sharp warning that we're about ready to do some tissue damage if we don't take care of this. Mizzle, who is a veterinarian out of the Schubolt School of Veterinary Medicine there in California, has done a considerable amount of research on parrot pain and management. Now, a lot of people will describe pain as being like one of the worst experiences possible. It has both physical and psychological effects because it can be so intense. And I'm sure you all have heard of the opioid crisis, of how serious chronic pain can get. Now, as humans, we can identify the traits of pain. For instance, I had 2 orthopedic surgeries within the past 2 years. And I can tell you, it was like the most excruciating thing I've ever gone through. And so part of my pre-surgery and post-surgery work was, identifying the pain and measuring it in a way that my doctors knew what action to take. Now, our birds don't have that ability. We can talk about it like we can say, okay, it's steady, or it's intermittent, it's throbbing or burning or stabbing or, aching. and it's causing me to not be able to perform any of my normal life activities. Those are the kind of things that we use to describe the intensity of pain. Now, our pets and our pet birds have those intensities of pain. They just can't communicate it. And furthermore, to complicate things with pet birds instinctually hide their pain, their illnesses, and their injuries. It's an instinctual thing. I mean, they're flock members, and they're the lowest on the food chain, per se. They are animals of prey. So a lot of different species will eat and kill birds. And so a bird, if it's in the flock, if it starts, demonstrating signs of being in pain or being injured or ill, the flock will either drive it off, or the bird will, slowly kind of wither away on its own. Because what happens is, if the bird were to stay in the flock and a predator saw them, the whole flock would be in danger. And so that's why birds really instinctually hide their pain. And our pet birds are no different. They hide their pain a lot. That's one of the things that makes researching pain management in pet birds so difficult, because it's hard to tell whether the pain medications are actually working or not. And we don't often spot pain unless we know the subtle cues of what to look for. So diving deeper into pet bird pain, or any pet animal pain, and people pain as well, we know that there's like 3 different levels of pain. So for instance, there's acute pain, there's chronic pain, and then there's kind of a cancerous level of pain, which is so stabbing that I guess you could say that your quality of life is just 0. So acute pain could be something like you say a traumatic injury, or being in shock. When I've broken a bone before, that's acute pain. That's something that is temporary. It's gonna go away at some point, but it does need treatment. Now, if you want to learn about some of the things that cause birds acute pain, head over to my blog on my blog post on the top 10 killers of pet birds. It's kind of a morose topic, but it's really important information to have, because if you know what those top killers are, you can prevent those from happening for your bird as much as possible. You can't prevent all accidents per se, but you can prevent a good many of them, and you can plan ahead. Chronic pain is going to be something different. So before my surgeries, I was having chronic pain. That was, literally pain that went on for years. And so it's, pain that's associated with, say, birth defects, an ongoing aging process related illness like arthritis or something like that. And then you couple, chronic pain in a bird with, say, a chronically poor diet, lack of exercise, that sort of thing. A bird's body is going to deteriorate and age faster than it would if it were having all of its wellness needs met. So chronic pain is really stressful, emotionally stressful, and it's related to, the failure to thrive. It's related to feather loss, poor feather condition, even feather plucking, weight loss, and just accelerated aging and deterioration. So it's something you want to spot and recognize and get a handle on as soon as possible. Of course, you love your pet, but it's hard to spot those subtle signs of chronic pain unless you know what to look for. Now, we know that birds are, they're fragile. They can go downhill really quickly. And usually, I will hear this a lot I do behavior consultations and talk with my clients all the time. And it is extremely common that someone, like for instance with a feather plucker, a person may not realize what's the root cause of that feather plucking. And they'll just kind of, the bird's plucking. But it's really a symptom that something more serious is going on. And finally, when a person decides, okay, I've got enough data or enough information, I'm going to do something about it, by the time they react, the bird is potentially so far compromised with its body that it passes on before a person even gets their bird supplies from me. It's a really sad situation because the pain is hard to spot unless you know what to look for. And that's one of the things that some of the clinicians out of the Richard M. Schubert School of Veterinary Medicine in Southern California have really studied. They've made it a mission to help us and other veterinarians know what to look for and improve the quality of lives of our pet birds. Now, you know, a lot of us wonder, well, why do I need an avian vet in the first place? Or why won't a general practitioner, a general veterinarian see my pet in an emergency? And the reasons are because birds are fragile. They have a pretty high mortality rate as compared to other animals. And the fact is that due to this instinctual need to hide pain, illness, and injuries, we don't know which medications. There's not much, the research is just really lacking in terms of which medications to use, which treatment modalities work best. Their bodies are pretty darn fragile, and so they can easily die, and a general practitioner is just not prepared to deal with that. Now let's talk about that a little bit more. So what is it about a bird that makes them so fragile and have such a higher mortality rate? Well, it all has to do with what their body, how their body works to allow them to fly. In order to fly, a bird has to be very lightweight. They have to carry minimal food in their digestive tract, and they have to carry minimal body fat in order to fly great distances. That means they have an extremely high metabolism rate and low body fat, so that when they stop eating or they go into shock and aren't eating, anything that would cause them to not eat, they can starve to death or go into shock very quickly and they can die very quickly. And so that's what makes a general practitioner, reluctant to see your bird in the case of an emergency. And then you couple that with this bird's instinctual need to hide its pain because they don't want to have predators come into the flock, and the bird stops eating when it's under duress. All of that stuff puts a bird at a disadvantage and makes doing research on how to treat pain management in birds really hard. So the literature is lacking, like I said, and things get very complicated very fast because we don't know. There's no FDA approval on many of these medications because there's not much research on which pain medications actually are safe and effective on birds. So the moral of the story here is to find a good vet, do your preventative medicine as much as possible, and stay on top of things. And I'll talk about what I mean by stay on top of things a little bit later. But keep in mind that a general practitioner isn't going to want to see your pet bird should an emergency arise. So that's all the more reason of why you need to stay on top of things. Now, I had mentioned earlier about this veterinarian, Dr. Mizzle, who has some really great articles on pain management and what we know about pain. I mean, she is kind of like the go-to bird pain person. And so she, like I said, has described these different levels of pain: acute pain, which is an injury; chronic pain, which is, an ongoing kind of degenerative type of pain. And then, of course, the news you don't want to hear, the cancerous type of pain, which is just unbearable pain that totally impacts your activities of daily living. So, bird pain management, in a nutshell, can get very complicated, and we do need to have these experts in order to know what to do with. Now, all that said, being in pain puts a tremendous amount of stress on anybody's body, but much less our birds. So what happens when a body is under that level of duress, that level of stress, is that, the body emits stress hormones. I'm sure you've heard of them, adrenaline, cortisol, endorphins. They emit that into the bloodstream. These are the hormones that allow us to take quick action and get out of danger quickly. Say a tiger were running after you, you could just sprint like you never have before because of these hormones that are released into the bloodstream. Now, those hormones are meant to have a temporary effect, but when a person or a bird is under chronic duress, those hormones are constantly being emitted into the bloodstream, and that takes a toll on the bird's body health. It affects other organs because those organs are like constantly shut down or activated in hyper alertness. That's what these hormones do, is they shut down certain organs and hyperactivate others. Now the liver in particular is very affected. The liver will emit proteins in order to respond to stress, but too much of these proteins literally puts the body in what we call systematic inflammatory response syndrome, which is just inflammation all over all the time. And if you've had inflammation, you know how painful that can be. So it's just kind of like snowball effect, if you will. Now, prevention, of course, is the method of choice, and the Shoebolt team really talks about that. They talk about how prevention is so important. Prevention includes all of the environmental parrot wellness things that I've mentioned earlier. There's 6 of them. I've got a blog post on it and a video on it as well. But if you want to monitor your bird's health, whether it's been injured or if it's in pain, you're going to want to gather up some equipment. First of all, you're going to want to get what's called a gram scale. A gram scale doesn't have to be fancy. You don't have to go buy a $150 gram scale because it's got a perch on it that's made for birds. You can just get one off of Amazon. Here's an example of one, and I'll talk a little bit more about a gram scale in a minute. You're also going to want to establish a bird-specific first aid kit. It'll have things in it like gauze, splints, different electrolytes to if your bird goes into shock, different little things like that. But one of the most important things is styptic powder. You'll want to have that in particular. Now, bird first aid kits can come in kits, or I've also got a blog post on how to make your own bird first aid kit. If you want. The little kits are kind of, the most minor that you would ever need, but if you really want to be proactive, make your own kit. Get on to, say, my blog post or another veterinarian's blog post. I'm not a veterinarian, but another blog post, and gather up a kit to have on hand in case the probable inevitable happens. You're also going to want to get what's called a hospital cage, and I've got a blog post, a couple of them, on how to make your own hospital cage. I have a couple of them for my 4 birds. I've got some for the medium bird, some for the large bird, and one for my little green cheek conure who just needs a small cage. What a hospital cage serves is it provides an atmosphere where you can not only monitor your bird, but you can kind of proactively provide for its care so that it stays warm, it's able to rest, and it's able to recover. So then you're going to also want to learn the signs of pain in birds, and I'll get into that when I talk about the pain assessment in birds questionnaire that I have on my website. So let's talk about the gram scale first, because that is really important. You'll be using this the most, okay? So vets tell us that it is really important to develop a routine of weighing your bird a minimum of once a week so that you can monitor for weight loss. So like I said, with the high metabolism, the low body fat, a bird can lose a lot of weight really quickly, and we know that when a bird loses 10% or more of its weight, something's pretty wrong, and you need to take some action quickly and get some veterinarian care. So for instance, here's little Kiwi. Now Kiwi had a little accident this past week, and I'll talk about it. Here's Kiwi in his hospital cage. He's in there just to demonstrate he's not sick. He recovered fully from his accident. But he's a little green cheek conure. His average weight is 63 grams. So 63 grams, well, this little bottle of medication, I'll have to put my glasses on, this styptic powder, just as an example, weighs 45 grams. So he weighs about as much as this. Now, if I were to take out 6 grams, which is like 1/8 of a teaspoon, I would not be able to detect that in this bottle. So a gram scale is grams are like the most minute measurement you can have. So this is a gram scale. This scale actually weighs in grams, ounces, and I think it'll weigh up to 6 pounds. I don't have a 6-pound bird. Probably nobody does. Unless you have a vulture or something. So what you do is you teach the bird to stand on the platform, and a bigger bird like my Moluccan Cockatoo, I could put a perch, and then you tear it out with this 0 right here. I think it's about ready to run out of batteries, but you tear it out with 0. And then with the perch on it, you put the bird on it, and you'll get the weight in grams. So if Kiwi were to lose 10% of his weight, I would never be able to tell by him sitting on my finger if he had lost 10%, 6 grams, but I would be able to tell by keeping a weekly log of his weight. And I'd like to keep it in a diary, where I'm monitoring it, and then you could even put it on like a bar graph and determine, okay, is he losing weight this week? And then you'd seek the help. So I hope that helps you to understand why you need a gram scale. It is probably the most important piece of equipment that you'll get for your bird, because it will allow you to spot whether your bird is not eating well and therefore losing weight and putting itself at risk for shock or death. Now, a bird first aid kit is something that, like I already mentioned, there's blog posts on how to create one for yourself. I like to put them in plastic tubs and make sure that everything's clean, and then minimum check them once a year, because they might have some medications, like say with an expiry date on them and that sort of thing. So minimally check them, maybe every new year or something like that. There's kits available on the market, like I said, but they're kind of the minimum of what you would need. And unless you have a emergency avian vet nearby, which is hard to find, you probably need a current avian first aid kit. Now, the hospital cage is also something that I found myself using more than I would like. And like I said, I always keep them in a same location so that I can find them. They're always, all of my hospital cages are actually converted bird carriers that I've adapted to be multi-purpose. A hospital cage, a sun cage even, and a travel carrier. So a hospital cage allows you to keep your bird quiet, inactive, warm, an atmosphere that literally promotes healing. And with it being clear, I'm able to observe my pet and he's able to see me. I can cover it up to block it out so that he gets some sleep. Or I can, on this one, I can purchase an item from K&H Manufacturing, which is called a Snuggle Up Cage Heater. It's a little device that's about the size of, I think they're 3x5 and 4x6. They come in 2 sizes. You can literally put it on those wired doors to keep the cage at a thermostatically controlled 103, which will allow my bird to recuperate and heal. And then the reason I love using these clear bird carriers is because I can not only observe my bird, but say it gets to the point where my bird's not recovering at a rate where I feel comfortable, I can get it to the vet without too much disturbance. If it broke a bone, of course you don't want to be moving it all over the place. You want to get it to the vet as quietly and as safely as possible. So with it already being in a bird carrier as you're observing it, that's just ideal for minimizing the stress that your bird would have to go through. Now, I had mentioned that a couple of things that happen when a bird is in stress would be, they stop eating, or they might have a traumatic injury, but birds also have a propensity to go into shock faster than most animals, basically because of that seriously high metabolism, and they stop eating, or their body reacts when they're, the endorphins and adrenaline, cortisol start getting in the bloodstream. Sometimes they'll literally go into heart irregularities, breathing difficulties, and that sort of thing. And they can die from shock very quickly. So it's important to know when your bird is in shock. And the symptoms are going to include, there's 8 symptoms. Let's talk about them real quick here. The first one is going to be rapid, shallow breathing. So how do you know if your bird's rapidly shallow breathing? You watch its tail. It has to literally work its chest muscles to breathe, and so its tail bobs up and down. If a bird is breathing at that intensity, you know something's wrong. It is really a sign that you need to get your bird to the vet ASAP. Any breathing difficulties are a sign of potential shock, and you need to get your bird to the vet ASAP. Heart irregularities, which you wouldn't be able to really see very easily. Cold, clammy skin, so they have trouble maintaining thermo temperatures in their body. Anxiety, disorientation, dizziness, you can observe those behaviors. And then, of course, the bird has the potential for going unconscious and dying very quickly in shock. So those are some things you want to watch out for. And I'll tell you a little situation with Kiwi here in a little bit. Now, 4 signs to look out for if your bird's in pain. And grab a pen and jot these down, or head over to my blog on how to tell if your bird's in pain, because I've got an infographic on it. Birds tend to overgroom the area or the painful site. So for instance, a bird that has, say, a compacted printing gland would be overprinting that and sometimes even digging into the skin. Unfortunately, it can turn into a habit if you don't catch it pretty quick. But overgrooming that painful site, just one site, is a sign that there's some inflammation going on there and your bird is trying to relieve itself. Another thing to look out for is, say, a normally calm, docile bird turning aggressive when people try to interact with it or pick it up. The bird is in pain and it just wants to be left alone. And so you'll see aggression, or alternatively just a decrease in social interactions. You might also see a bird that's in chronic pain guarding the area of the painful site. So if their leg is limp, they might be perching on just one leg, or drooping a wing away from your site, that kind of thing. So just unusual body positions is something to look out for. Now, here's the situation that happened with little Kiwi this last weekend. Saturday evening, I was just fixing dinner and everything, and Kiwi was out on his little play stand. He's really good about staying on his play stand, but the dogs came in because I was feeding him a little later than usual, barking like crazy, and it scared Kiwi, the little green cheek conure, and flew off the play stand right into the dogs. And I wasn't sure if they bit him or just maybe trampled on him or any of that. I wasn't sure. But I got him and put him in his cage and watched him all evening long. Of course, he was hiding his illness from me, okay, or hiding his stress level from me. So in the evening before I went to bed, he didn't seem too abnormal. But when I got up the next morning, there were some things going on. First of all, Kiwi wakes me up. He's my little alarm clock. He starts squawking at 6 a.m. every morning. I don't know why 6, but that's his time. And, chirping, hey, come on, get up. He's calling me on his flock. And I didn't realize that he didn't wake me up until about 10. I got up, obviously, but he was pretty quiet. And then I have a routine where I give my birds, their first meal of the day is always just a plethora of vegetables, and all of my birds have been trained or taught how to eat their vegetables. It's something that's really important to us because it's so important for their nutrition. My birds love it. It's a routine that they get really excited about. Kiwi didn't eat his vegetables. So sign number 2, okay, something's not right with Kiwi. Then I started looking at the bottom of his cage, realized his droppings were not normal, and his activity level was not normal. So I got the hospital cage out and put some millet in the bottom, because that's another favorite, hoping, okay, maybe he'll start eating a little bit. Weighed him, he lost a little bit of weight overnight. And so that's when I began kind of seeking out an emergency avian vet. Now we have a couple of emergency clinics here in the town I live in. I live in a suburb of Denver, and there's several avian vets in Denver. So it really never, I guess I hadn't created a list of how to contact an emergency avian vet, because now it's Sunday morning, 10 o'clock. And my vet office is closed. The number that they have on their answering machine to call was not active, and so their exotic pet vet had left the practice, is actually what happened. And so they said, call this clinic. Called them, that exotic pet vet had left the clinic, and I probably made 10 phone calls before I found this company who did have an emergency exotic pet vet on staff, able to see my bird, and got the bird up there. It was only a 25-minute drive. But I probably spent an hour looking for that emergency vet. So moral of the story there is refresh this and make sure that I would have this in my bird first aid kit going forward, and this would be the thing that I'd check up on at least annually. Quite frankly, it's probably one of the first times that I've ever had to use an avian vet on off hours. And so I haven't really had much history of needing to use an emeRgency vet clinic. So anyway, I was able to stabilize Kiwi, literally got him to the vet, and here's something I'm kind of proud of, but the vet said, your bird is in such good feather, it's hard to see whether a dog has bitten it or not, but there's no bruising, there's no visible signs of a puncture or anything. The vet says, I just feel like he's in a little bit of a shock, and that maybe some pain, and we need to maybe give him some Medicam for the pain. This is a pain video, by the way. And so, with that said, that's just a recap of how these things happen so fast, and you have to know what signs to look for. So, getting back to the infographic, Kiwi was guarding himself by kind of shying away and not wanting to be picked up, or not wanting me to interact, not even wanting to wake me up that morning. That's how bad he didn't want to interact. Wasn't eating, and wasn't moving. And so those were some signs, subtle cues that had I not known what to look for, I would have totally missed that, hey, Kiwi's kind of not doing so well this morning. So learn those signs and log into that blog and get that free download of the pain assessment questionnaire for birds that I've adapted from some veterinarians that I've done some research with. So what you want to do, again, you have the preventative gear, the gram scale, the hospital cage, the first aid kit, and the pain assessment questionnaire. What not to do is you don't want to cuddle and console a bird that's injured. If it had a broken leg and you're just, trying to move it and stuff, that would be incredibly painful. That could cause enough pain that would put a bird in shock. So let the bird relax in the comfort of a hospital cage, and never, ever, ever give your bird over-the-counter medications, especially those made for humans or that were given to you for, say, another pet like a dog or a mammal of some sort. You'd never know, the correct dosage to give for a bird, and the birds have very fragile organs, and you could cause it to have liver damage and permanent damage to some other organ without even knowing it. So stay away from aspirin, baby aspirin, ibuprofen, what's the other one, Tylenol. you definitely don't want to give your bird any of that. I have people call me up, you know, wanting consultation for the feather plucking and bird wellness stuff, bird behavior challenges and stuff. And one guy, he'd even told me he gave his bird his own Xanax. And I was like, holy mackerel. I think that stuff happens a little more than we'd like to think about, but it's dangerous and it could literally kill your bird. So don't do that. So just to recap, you know, I've talked a lot about how to recognize bird pain, how to prevent it, how to deal with it if it happens. You know, look for those symptoms, download the pain questionnaire, and be on top of it, because pain prevention and management is probably one of the most important things you can do to enhance your bird's quality of life and prevent more challenging behaviors from occurring down the line. So if you liked the video, please leave a comment, give me a thumbs up. And you know, I'm putting out a lot of these videos lately, so you know, go ahead and subscribe to me. There's a button down there, and just click that and you'll get a little a bell button. You'll get a little ding when I put a new video on, and then you can subscribe, because I put on these pretty intensive videos. They're not just your ordinary, you know, bird behavior videos or anything. They're pretty intense, kind of complementary with my training and stuff. So be sure to, you know, subscribe. And join me on my next video. Share this video with your friends and on social media. I'd sure appreciate it, because that helps me have, you know, the desire and the funding, if you will, to put out more and more videos and know what you guys are wanting. If there's any special kind of training you want, hey, go to birdsupplies.com and reach out to me on my Contact Us page and say, hey, I need training on this or that, and I'll be happy to accommodate. Helps me to know what my customers need and to provide some relevant information. So until next time, probably next week or the week after, I'll put another video up. Have a good week. It's summer now, almost, and time to get out and enjoy the world. So we'll talk later, and thanks for joining me. Bye-bye.